The quality practice elements came about because in the evaluation we were looking to establish some benchmarks of quality practice and men's behaviour change program work. So the quality practice elements scope out ways in which a number of our programs are trying to stretch and extend and put into practice the things we already know that we want to do to be able to extend the effectiveness of our programs. So it's as much about supporting continuous improvement as it is about what are the safe minimums to make sure that we are supporting safety and trying to minimise the risk of doing inadvertent harm. The quality practice elements consist of 9 themes. Each of the themes have a number of elements, and there are 60 elements overall across the document.
So the QPEs provide a roadmap that we can look up that sets a path to where we want to be. Don't get overwhelmed. These QPEs will show you what you are also doing really well.
So I think the QPEs can be implemented, but they need to be very place-based in accordance to what referral pathways are available and resources in the community. So, for example, if as a women's advocate we wanted to refer children to DB-specific counselling or play-based sort of therapy, we've only got safe spaces and the wait list is months long for that. So what can we be doing as an alternative to get those kids early into support rather than when it's too late? I really like the reflection rubric that they touched on. I think that would be really good to use in an integrated team with the Men Choosing Change facilitators and the women's advocates and safe spaces, because we all work together about what we could improve on in our practice, what's working well, what could be better.
I think, when I look at the service requirements, like the perpetrator intervention service requirements in Queensland, there's a lot of detail in there around really, length of program, how many men can be in the program, the qualification and experiences of facilitators, women's advocates, but there's nothing in there around what we're actually doing with the men. Like in terms of the actual curriculum, there's nothing in there around service. There's no requirement to have a wait list in our perpetrator intervention service requirements, so it's up to services whether they're doing a wait list and managing the risk on that, but there's no guidance there, and there's no funding going towards it, and there's no requirements to do one-on-one work. There's no requirements to do an assessment in your own organisation or have a referrer to the assessment. So there's no. So I could see the value if there's a resource that is saying like, this is best practice. This is what what would work. What's missing in our current service requirements? And either it's now an individual service can look at that as guidance, or does this go to the department for a review of our perpetrator intervention service requirements?
These QPEs and what some of their relevance or applicability or matching them to the Queensland context. I think when I think about piloting for my community, for LGBTIQA, sister girl, brother boy communities, there's been some really great research done onto the state of systems and research and the evidence base and the practice base in Australia. And one of the things I think that the literature and the evidence is throwing up is that the use of piloting is often a kind of one and done. It's a single program that doesn't necessarily get renewed. And when I think of these QPEs and I think of communities, my communities in Queensland, I think that, they're a great tool, probably a reflective tool for a beginning that needs a sustained, long-term, long-durational, committed, ongoing investment and the opportunity to grow a workforce, to grow community trust and to grow I saw one of the themes was, self-determination and community ownership. Like that is going to need time for LGBTIQA sister girl, brother boy communities to feel like they've got a stake, they've got some ownership, that they've got a level of transparency and trust and accountability in programming, as well as the opportunities. Another theme is team building. There's going to need a really sustained approach to build a workforce, an identified workforce of LGBTIQA sister girl, brother boy workers, to be able to build this practice, build relationship with their communities, demonstrate that frankly, what is often described in really gendered, really binary, really, heteronormative, cisnormative terms, workers need the opportunity to do the knowledge translation and the practice translation, and be in dialogue with communities.
And I think also with pilot programs that are government funded and evaluated, do those evaluations then just get owned by the department and kept at the department and not shared? So when we think about, interviewing victim survivors who share their experience and their stories, but nothing gets done with them, if the learnings aren't shared, keeping in mind obviously around unintended consequences and safety and data sovereignty. But I think about pilot programs where they are evaluated and the sector doesn't get to learn anything from them. So I think we have to rethink sometimes how we share and disseminate learnings from evaluations, but just particularly for pilots.
Yeah, absolutely.
Yeah.
As a women's advocate, I'd be interested of how the QPEs relate to me. And I know that it's one of the key themes around women's advocacy. I know victim survivors are front and centre for them, but I wonder what part of the QPEs will relate to me directly. But I think for our facilitators, I think there are strengths and barriers that we always have: time, money, and they're always looking to improve. So I don't think it's a lack of willingness. And I think that if they can find a way to make effective use of the QPEs, they definitely would. But I think how do we do that? Is it through team meetings? Is it something they have to start integrating? Do they replace something with something else? I know Uniting Care, we don't do anything in isolation. You have to go through managers, make sure we have permission before we implement new forms, new ways of doing things. So it's actually we might receive this, next month, but we might not be able to use it and really implement it for months later. So that's definitely an issue. I think that will come up, time constraints. Facilitators already have so much on their plate. Making changes and all those kind of things is going to be difficult.
What I really like what Rodney Marie talked about is that reflective practice, and I'm big on that. Like having going back and getting feedback, critical feedback, is important, and I think that having the QPE there would be a really good, for me personally, would be very beneficial. Just in a reflective sense.
Actually, that's something I think I would have liked to add to, I guess, my response is that that is a big thing for us as well. For the facilitators I work with, reflective practice is one of their, and learning is one of their core values. And we talk about it a lot in our team practice meetings and stuff like that. How do we learn? How do we move forward? So if QPEs can facilitate, I guess that's how I guess they'll be best used.